Good morning, everybody. I hope you are all doing fantastic. So for today's Wellness Wednesday, we are going to hit a very interesting topic that we actually see quite a bit of here in the office. So today, we are going to talk about, surprise, surprise, fibromyalgia, sometimes abbreviated as FMS, fibromyalgia syndrome. Most people call it fibro, and hyperbaric oxygen therapy. So fibromyalgia is a rather persistent and debilitating disorder. Depending on whose research you look at, roughly 4% of the population is affected by it. More commonly females than males, roughly a 9-to-1 ratio. Here's something really interesting. Fibromyalgia is an important representative example of the central nervous system, how it can be sensitized, so how its perception can be increased, and how it's associated with abnormal brain activity, which is kind of crazy. Some of the key symptoms of FMS are chronic widespread pain, allodynia, which is an abnormal sensitivity to pain. It's a heightened sense of pain. Diffuse tenderness, along with fatigue and sleep disturbances. So many professions still have trouble pinpointing fibromyalgia or FMS. So let's jump into one of the super awesome studies that have been done on FMS. So they had a baseline group and ran through all of the treatment on these. So let's jump into it. The treated group was evaluated at baseline and after hyperbaric oxygen therapy. There were patients in the crossover group. These people were evaluated 3 times, a baseline, after a control period of no treatment, and then after HBOT. The evaluations consisted of an exam, including a tender point count, pain threshold measurement, extensive evaluations of their quality of life, and SPECT scans, or single photon emissions computed tomography, SPECT images. What they look at with SPECT images are your brain activity. So the control group for HBOT, for hyperbaric oxygen, was 40 sessions, 5 days a week, 90-minute sessions treated at 100% oxygen at 2 atmospheres. The group were 60 female patients aged 21 to 67, and they had to have had FMS diagnosed at least 2 years earlier. Both groups, there was a significant improvement or reduction in all of the fibromyalgia symptoms, including a drastic improvement in the quality of life. When they went back and looked at the SPECT imaging, so the brain pictures that they took, it revealed there was a massive reduction in abnormal brain activity, decrease of the hyperactivity in the posterior region, so back here, which is where a lot of our muscle control comes from, and reduced activity in the frontal area, so one of the hyperexcited areas. Pretty darn neat. So now let's get into some of the mechanisms of action. So why it works. How does hyperbaric oxygen therapy help fibromyalgia? It increases the circulatory pathways within the brain. It enhances memory and mental performance. It improves oxygenation of the brain. It helps recover and repair damaged brain tissue. And it can help people develop and regain cognitive and motor functions. So what's it do to the nervous system? It will help reduce swelling on the brain, decreases pressure within the skull. We actually get a lot of people saying they have that pressure feeling in their head. Reduces the risk of compromised blood flow to the brain, and it minimizes oxidative stress. Now, here's some cool stuff. It increases the regeneration of the nervous system as well. It actually stimulates the creation of new brain cells. It facilitates the formation of new brain connections, and it promotes the construction of new brain tissue. So now, just a number of other brain/nervous system issues that can be helped with it just by looking at what it simply does. So, as always, if you guys and gals out there have any questions or comments, feel free to post them in the video below, and I will answer them as soon as I see them pop up. Have a great day, P.L.L.C. See ya.